The gut-brain axis is a real and well-documented bidirectional communication system. When the gut is inflamed, the brain knows it. Anxiety and low mood are increasingly linked to gut dysbiosis, specifically because the gut produces the majority of your body's serotonin.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
There's a pattern we see in this practice more than anything else. People coming in having been told that their labs are normal. They've seen multiple doctors, they've been handed referrals, maybe a prescription, maybe a recommendation to reduce stress, but they still feel terrible. And fatigue that doesn't respond to getting enough sleep, bloating, gas, unpredictable digestion, brain fog or joint pain, skin issues, anxiety that doesn't match their life circumstances. These are all the things that seem to be just unmeasured, unmanaged, and really unaware in the medical profession. And not a single specialist is connecting the dots because each one is only looking at their corner of what they do. We look at the whole picture. And when we do, very often, the answer starts in the same place, the gut. If you've been listening to the show long enough, if you've followed along long enough, you know that the gut is the starting point for most, if not all, chronic disease and inflammatory conditions. And so today, I want to walk you through exactly what is happening inside the gut and the most common pattern that we see and treat. And that is leaky gut combined with inflammatory dysbiosis. I want to explain what it actually is, what it does to your body, how you can test for it accurately, and how you can treat it in a way that makes sense from a mechanistic point. So let's get right into it. Again, welcome to Health Decoded. I'm your host, Dr. Alessi. If you're new here, I'm an integrative functional medicine doctor, which means I'm not your conventional doctor, and I'm not trying to be. Conventional medicine is great. It's essential. It's extraordinary for acute care, emergency interventions, and diagnostics, diseases that are already declaring themselves being proven. What it is not built to do is to catch the slow burn or the internal things that are under wraps that eventually will gradually unravel and cause dysfunction years before anything shows up on testing. And that is the space that I work in. The gut is almost always part of that conversation. So today's episode is going to have 4 parts. Number 1, what is leaky gut and dysbiosis, what they actually are, what they produce symptomatically and why, how we test for them with precision, with specific tests that we use within our clinic and at home that patients can do, and how we treat them through structured, logical protocols. No guessing, no oversimplification. So let's go. Let's get right into it. So let's start off with the first piece here. What is leaky gut, dysbiosis, the connection, and why is it so important? So first, to break it all the way down, let's start with the gut itself, because most people significantly underestimate what it actually does. The gut is not just a tube. It's not just a digestive tube. It is your body's most sophisticated interface with the outside world. So everything that you eat, you drink, you ingest has to pass through or be processed by the gut before it enters your body properly. And the gut has evolved to be extraordinarily selective about what it lets through. The inner lining of your intestines is 1 cell layer thick. That's it. 1 single cell layer, and that layer is held together by protein structures called tight junctions that are arranged in almost like a linear way. Think of them as like the seal between tiles, right? And so when those seals are intact, the gut is going to allow specific nutrients through, like water and specific molecules, in a controlled and selective way. Everything else, like toxins, bacteria, larger undigested food particles, is not supposed to pass through. It's basically blocked or limited. That is what we call selective permeability. So your gut, or a healthy gut, has a controlled selective border. Now, Inside that gut lives an ecosystem of roughly 38 trillion microorganisms. This consists of bacteria, yeast, fungi, viruses, parasites, more microbial cells than you actually have human cells in your body. This ecosystem is what we call the microbiome. That's a term people have heard. It is not incidental to your health. It is central to your health. So essentially, we're controlled more by bacteria than we are by our own neurology. The microbiome trains your immune system. It works in conjunction. It basically tells it what to do through signaling molecules. These are what we call neurotransmitters. So your microbiome produces neurotransmitters, including the majority of your body's serotonin. About 80% of serotonin is produced in the gut, which regulates inflammation. The microbiome communicates directly with your brain via the vagus nerve. You ever been really stressed out and really anxious and had kind of like an upset stomach? That's because of that connection. It metabolizes hormones. It is one of the most metabolically active systems in your body. And for most of modern medicine's history, we have pretty much ignored the gut. It's been something that has not been addressed, not been looked at, and almost basically abused when we give people medication without actually understanding. And so when the microbiome is balanced, the right organisms in the right ratios, you're going to have resilience. When it's imbalanced, you have what we call dysbiosis, imbalance. Dysbiosis means the ecosystem has gone wrong. Beneficial bacteria are possibly depleted. There's opportunistic organisms, pathogens, or what we would call pathobionts. They have overgrown and they take the territory over. And so this can include harmful bacterial strains, yeast, parasites, fungus, and other organisms that in small amounts are manageable and we should have, but when they dominate, they become significant drivers of dysfunction. Dysbiosis does something very specific and very damaging to that one cell thick gut lining. So harmful bacteria, particularly gram-negative bacteria, produce a compound called lipopolysaccharide, or LPS. LPS is essentially the outer membrane fragment of those bacteria, and it is directly toxic to the tight junction proteins that hold your gut lining together. When LPS accumulates, which happens reliably in states of dysbiosis, those tight junctions begin to degrade. The seals fail, the gut lining becomes permeable. Things that should stay contained inside the gut are now able to pass through into your bloodstream and lymphatic system. This is what we call intestinal hyperpermeability. The lines are becoming open. Leaky gut is what we will reference it as. I want to address that term directly, though, because it does get questioned in conventional medicine. Primary care doctors, conventional medicine doctors, they say leaky gut sounds colloquial, and some physicians often dismiss it just on those grounds alone. But the underlying mechanism, intestinal hyperpermeability, tight junction degradation, LPS translocation, this is extensively documented in peer-reviewed research. We use both terms because leaky gut is what people recognize. It's what people are searching for. It's understood. If I said intestinal hyperpermeability, that goes over people's heads. They often would just dismiss that and not be aware of what that means, because that is what is scientifically precise. So it's the same condition. Both terms are valid. For sake of this episode, I will use both. And so to kind of wrap up what leaky gut is, again, the gut microbiome becomes imbalanced. That's the dysbiosis piece. That imbalance then leads to degradation of the protective lining of the gut. That's the intestinal hyperpermeability, or leaky gut. The barrier that was supposed to protect your bloodstream from the contents of your gut has been compromised. What happens next is where this becomes a whole body problem, not just a gut problem. And so let's get into it. What does the gut produce? What does leaky gut produce? The immune cascade that occurs and why it can look different for different people. So when the gut barrier begins to break down, the immune system is going to become the next chapter of this story. And understanding that is what explains why leaky gut and dysbiosis produce such a wide, just confusing range of symptoms and across different people. So here's the mechanism. Roughly 70 to 80% of your immune tissue lives in and around the gastrointestinal tract. It's positioned there deliberately. This is to survey what crosses the gut lining and respond to threats. When the barrier is intact, this system works perfectly. When the barrier is compromised, the immune system begins encountering things it was not designed to tolerate at scale. Bacterial fragments, partially digested food proteins, and specifically that compound LPS that I described earlier, which the immune system will identify these immediately as a threat, as a pathogen signal. There is a receptor on your immune cells called TLR4, toll-like receptor 4. Its job is to detect LPS. When it detects it, it activates an inflammatory signal, which is a cascade that orders the production of inflammatory proteins called cytokines, specifically one called TNF-alpha, another one called interleukin-6 or IL-6, and interleukin-1 beta. These are your body's alarm signals. In an acute infection, this response is appropriate and it's life-saving, and it can prevent you from having big deal things. The immune system fires, and so this clears the threat stands down. But when the gut barrier is chronically compromised, LPS is not just happening one time, it's crossing continuously. The immune alarm is not just responding to a single event, it's running all the time. Now, this is where this can become an issue. This is what we call chronic systemic inflammation driven by gut permeability. And this is what we mean by inflammatory dysbiosis, an ongoing low-grade immune activation state that originates in the gut, but it's going to express itself throughout the body. Now, let me explain why the same issue can look different from person to person. That inflammatory signal, those cytokines, travel through the bloodstream and lymphatic system, and they land wherever your individual genetics, your prior exposures, your nutritional status, and your stress load make you the most vulnerable. The gut is the source, the expression itself is individual. So one person's chronic gut inflammation can manifest as joint pain and stiffness because their immune response targets joint tissue. Another person's manifests as eczema or psoriasis because the skin becomes a reactive site. Someone else develops brain fog or mood disturbances, anxiety, because neuroinflammation is their pattern. Another person would develop thyroid antibodies. This was my story. Another person can have recurring sinus infections or these pressures in their head. Another has expanding food sensitivity. Someone else could have metabolic dysfunction or weight gain. Again, the same upstream cause, completely different downstream presentations. This is precisely why patients cycle through specialists without resolution. Because the rheumatologist sees the joint inflammation, the dermatologist sees the skin, the psychiatrist sees the anxiety. None of them are looking at the gut because conventional medicine doesn't have a framework for a single gut-based mechanism that produces multi-system symptoms. Each symptom gets its own diagnosis. Each diagnosis gets its own medication, and none of it actually addresses what is driving the problem in the first place. So let me walk through specific symptom clusters that we commonly see so that you can recognize patterns. So the first one is often, the most common, digestive symptoms. These are often present, but not always the chief complaint, which can surprise people when it comes to leaky gut. So things like bloating, particularly the kind that accumulates throughout the day, gas, irregular bowel habits, constipation, diarrhea, or alternating between the two, abdominal discomfort after eating, reflux. Some people have significant intestinal hyperpermeability with very mild digestive symptoms, which is part of why it gets missed and makes it so confusing. The next thing is often cognitive or neurological symptoms. We see this all the time. Extremely common and can be the most debilitating. The brain fog or the mental cloudiness, difficulty concentrating, finding words, not knowing how to voice something, memory recall, all of that. is a direct product of neuroinflammation driven by systemic cytokine activity. The gut-brain axis is a real and well-documented bidirectional communication system. When the gut is inflamed, the brain knows it. Anxiety and low mood are increasingly linked to gut dysbiosis, specifically because the gut produces the majority of your body's serotonin, and dysbiosis disrupts that production. Non-restorative fatigue, so the type that sleep does not fix. It's another consistent hallmark. We hear these things all the time. The next thing is immune dysregulation, things showing up as like recurring infections because the immune system is dysregulated rather than properly calibrated. Increasingly, we're seeing autoimmune conditions when the immune system is chronically activated and repeatedly exposed to foreign proteins crossing a permeable gut barrier. The risk of something called molecular mimicry increases. Basically, the immune system begins misidentifying self-tissue, your own body's tissue, as foreign, and it attacks it. We see this in skin manifestations, things like acne, eczema, psoriasis, or rosacea. Well-established mechanistic connection to gut dysbiosis through the gut-skin axis. Oftentimes, when people start repairing their gut or working towards their gut, they're going to have worsened skin issues because of this. The skin is a common site of immune reactivity when the gut is the source. We see hormonal and metabolic dysfunction. The gut microbiome directly participates in estrogen metabolism, thyroid hormone conversion, blood sugar regulation, and metabolic signaling. So chronic dysbiosis can contribute to hormone imbalance, resistance to insulin, and then weight that resists standard diet and exercise protocols. And then one of the main things we also see, expanding food sensitivities, one of the most telling signs. So when the gut barrier is compromised, food proteins crossing into circulation in a form of an immune system does not recognize as safe. So the immune system will mount a reaction over time because the gut barrier remains compromised. This list or this amount of reactive foods can grow. This is not like a food allergy. So when you have an allergy, that is an anaphylactic response that is life-threatening. Things like nut allergies are very common. This is what we call a sensitivity, and it's secondary to barrier dysfunction. Now, the tough part is these are hard to catch because you eat a food, it creates an inflammatory sensitivity and immune response that often doesn't show up for 6, 12, maybe 24 hours. By that point, you've probably had 2, 3, maybe 4 other meals with other foods. So it's hard to pinpoint which foods are causing it. One important clarification that I need to make sure I say is not every person presenting with these symptoms that I just said has leaky gut and dysbiosis as the primary driver. These symptoms can have multiple potential causes. However, the gut is very often the central mechanism. So it is not the only possible mechanism, which is why we don't assume, we test everything, and we test comprehensively. And so that's what we're going to get into now in this next piece. But before we get into testing and the action, let's hear a quick word from our show sponsor today. Hey, busy professionals and parents, let me ask you something. Do you need help with your low energy, stubborn weight, brain fog, gut issues, or hormones, but you don't know where to start? Well, you're not alone. And the biggest problem is that modern healthcare is designed to diagnose disease, but often misses the dysfunction that begins years earlier as under the surface symptoms. That's exactly why I created the Functional Medicine Starter System. This is a structured, physician-led process designed to uncover what is actually driving your symptoms, whether it's rooted in gut health, metabolic function, inflammation, nutrient status, or hormonal imbalance. No guessing, no generic protocols, just real data and a clear plan. So if you're tired of searching for answers, but you're not sure how to begin solving your health issues, go to the link in the podcast show notes to learn more about the Functional Medicine Starter System. Because once you have clarity, you can finally start to feel like yourself again. Now, let's get back to the episode. All right, welcome back. So let's get into it now. How do we test for leaky gut, dysbiosis? We use what we call a gut zoomer test. One of the most consistent things I hear from patients is that they've been told their gut is fine based on a colonoscopy or a basic stool culture or a standard blood panel. The issue is not that those tests are useless. The issue is that they are not designed to look for what we're looking for, and that's dysbiosis and leaky gut. A colonoscopy evaluates the structure of the colon. It doesn't go far enough up. It's going to find things like polyps, lesions, inflammation that has progressed to visible tissue damage. It tells you nothing about the microbial ecosystem living in the colon. A basic stool culture tests for a short list of known pathogens only. So a standard blood panel is also not enough to evaluate the microbiome at all. So it has nothing to do with it. Let me rephrase. It's not that it has nothing to do with it. It's just not deep enough. None of these tests are detecting dysbiosis. None of them measure intestinal permeability. None of them show you what is actually living in the gut because they were not designed to. And that's not the fault of the test. It's just not what it's used for. So if you want more of a precise measurement, you need a more precise test. And this is the gap that comprehensive functional stool testing will fill. The panel that we use is called a gut zoomer. It's a DNA-based stool analysis that maps the gut ecosystem with a level of precision that those conventional tests just don't have. The gut zoomer uses quantitative PCR, which is polymerase chain reaction, which identifies and measures organisms by their genetic structure. This is not dependent on whether an organism grows in a lab culture. It detects what is present and quantifies it. That distinction matters because many organisms that drive significant gut dysfunction are notoriously difficult to culture. On a conventional stool culture, they're missed. On PCR-based analysis, they will show up clearly. And so let's get into what does the gut zoomer actually measure. So number one, bacteria, the full spectrum. It's going to measure probiotic bacteria, beneficial organisms like lactobacillus and bifidobacterium, the species that support the immune function, and actually produce short-chain fatty acids to maintain integrity of the gut barrier. We see how depleted they are, and we can see by how much. It measures commensal bacteria. These are organisms that are neutral in balance, but problematic when overgrown. It also measures pathobionts, organisms that are present in small amounts in a healthy gut, but can become drivers of disease when they proliferate. And known bacterial pathogens, things like H. pylori, C. diff, Campylobacter, E. coli, and variants of Salmonella, Shigella, and others. It's going to measure yeast and fungus, including Candida species, which are among the most consistently missed drivers of chronic gut dysfunction and something that we catch all the time. Overgrowth of Candida is actually not as rare as you would think, and it's pretty routine in patients with a history of antibiotic use, high sugar diets, or immune dysregulation, but it simply doesn't get looked for. The next thing we see is mold. Environmental mold can actually colonize in the gut and drive inflammatory patterns that are rarely considered in standard clinical workups. Viruses, which can interact with and influence bacterial populations in ways that are increasingly understood to affect the balance of the microbiome. Parasites and worms, things like Giardia, Cryptosporidium, Blastocystis hominis, helminth species. These are not exotic findings. They're found routinely on comprehensive testing and routinely missed on conventional testing. They're also significant drivers of immune dysregulation and barrier disruption. It also tests, and this is the most important piece for me, is intestinal permeability markers, including what's called zonulin. Zonulin is the protein that directly regulates that tight junction integrity. Zonulin is one of the most clinically meaningful direct markers of leaky gut that we have. When it's elevated, the gut lining is compromised. That's it. Gut inflammation markers, so calprotectin, which measures active intestinal inflammation, secretory IgA, which reflects the immune activity and first-line defense capacity of the gut lining itself. It measures digestive function markers. Pancreatic elastase tells us whether the pancreas is producing adequate digestive enzymes. Fat steatocrit assesses fat absorption. These tell us whether the gut has the functional capacity to break down and absorb nutrients properly, which is critical for the treatment plan. The result of this test is a complete clinical map, not a yes or no answer. It's a detailed picture of the ecosystem, its deficiencies, its threats, and its inflammatory state, as well as its functional capacity. Now, that map is what then drives a precise, individualized treatment protocol rather than a generic one drug, one fix thing. And so from a practical standpoint, this is an easy test for people to integrate because it's a home stool collection. You don't have to go to some lab and have some invasive test done. Patients collect a sample in their own bathroom, ship it with a kit, and the results come back in approximately 2 weeks. There's no procedure, no preparation, no discomfort. And for the diagnostic depth that it provides, it is actually one of the highest yield tests that we use. And so now that you have that information, you have a roadmap, you have a clinical understanding of what's going on in someone's gut. What do you do with that? How do you treat it? Well, the process that we use, and it's really just because it makes sense, is called our 6R protocol. And so I want to get into that. The treatment is where we see the most well-intentioned mistakes, because in conventional medicine and also in the wellness space, it's equal. The conventional medicine approach, when gut issues are acknowledged, tends to manage symptoms, right? They're going to give you antacids for reflux. They're going to give you antispasmodics for IBS symptoms. They're going to give antibiotics when there's a specific pathogen detected. But these all have their place, but they don't restore the actual ecosystem. They don't repair the leaky gut barrier, and they don't address what's driving the dysfunction in the first place. In the wellness space, what we're seeing, common mistakes, it's different. People hear gut health and they immediately start taking probiotics. Not that probiotics are wrong, but when they're completely ineffective and can be counterproductive when they're introduced into a gut that's overrun with pathogens and has a compromised lining, you're basically adding beneficial bacteria to an environment that can't support them. They don't get established, and then the underlying dysfunction just continues unchanged. The reason a structured protocol works where these don't comes down to one principle. You have to sequence the treatment to match biology. That's it. The gut ecosystem broke down in a sequence. It has to be restored in a sequence. We call the protocol that we use the 6R protocol. And this was something that I developed based on my own gut health issues. I took existing research, existing protocols that worked but were maybe not complete, and I just fine-tuned it specifically for dysbiosis and leaky gut. And so it makes sense because each step in the sequence follows the previous step. You can't just start putting up the roof of a house if you haven't built the foundation first. So you have to start in order. The first step of the 6R protocol, R1, is remove. Because before you can rebuild anything, you have to clear what is actively driving the dysfunction in the first place. Now, the remove part has two components: pathogen elimination and driver removal. Pathogen elimination means targeted interventions against the pathogenic organisms identified on the gut zoomer, the bacteria, the yeast, the parasites or worms that are present and problematic. Depending on what is found, this involves targeted antimicrobials, herbal, possibly pharmaceutical, specific antifungals or antiparasitic agents. And it's not just a generic gut cleanse. It's targeted because we know exactly what we're targeting. And those specific pathogens often have defenses built in, and we need to make sure we break those defenses down. The next thing is the driver removal. So this means eliminating the dietary and lifestyle inputs that are actively sustaining the dysbiosis or damage to the gut lining. Things like refined sugars, processed carbs, these are primary fuel sources for pathogens. Alcohol directly degrades tight junctions, so this has to go. Ultra-processed foods, certain food additives, and individually identified inflammatory foods are removed based on this clinical picture. Any type of chronic NSAID use, so nonsteroidal anti-inflammatory drugs, proton pump inhibitors, and other medications that impair gut integrity, They're assessed and addressed where clinically feasible. Chronic physiological stress and sleep deprivation are often huge drivers of gut permeability and microbiome disruption through the HPA axis. And so these are not optional. They're part of the remove phase because we cannot repair the gut while leaving the primary drivers in place. And so this step is critical and creates the conditions for everything that follows. Now, the next step, R2, replace. So once the pathogens are addressed, drivers are removed, the gut still now has a functional deficit. And so in states of chronic dysbiosis and inflammation, digestive capacity is frequently impaired. The pancreas and biliary systems aren't producing the adequate enzymes and acids to properly break down food. This means food is arriving in the lower gut, partially undigested, which becomes its own driver of microbial fermentation and gas production and the continued imbalance. So in this phase, replace means restoring digestive function, targeted digestive enzymes, hydrochloric acid support if necessary, bile salts for fat digestion. This step also addresses the nutritional deficiencies that the chronic gut inflammation and malabsorption have produced. Things like zinc, magnesium, B vitamins, fat-soluble vitamins like A, D, E, and K. These are commonly depleted and must be restored. Healing requires these raw materials. If those materials are deficient, healing will be impaired regardless of what you do. R number 3, so step 3 is to reinoculate. Now, and only now, we reintroduce beneficial microorganisms. Again, this cannot happen too soon. So reinoculating means strategically repopulating the gut with probiotic organisms that the dysbiosis depleted. Lactobacillus and bifidobacterium species and others guided by what the gut zoomer showed as deficient. It also means introducing targeted prebiotic fibers and substrates that the beneficial bacteria can use as fuel so that the introduced organisms can actually establish themselves and complete effectively for the territory. In a gut that has been cleared of pathogens and has adequate digestive support, the beneficial bacteria can now actually take hold in there. And what they do is they begin to produce things called short-chain fatty acids, particularly a compound called butyrate, which is the primary energy source for the colonocytes, which are the cells that make up that colon lining. So you get to see the picture here, right? We have to clear out. Now we're rebuilding the ecosystem so that the ecosystem can produce the things that are going to heal the gut barrier. Because then the next step is what we call repair. And so without remove and replace first, the reinoculate phase, it fails. But with them, it works and sets us up for phase 4, which is repair. Repopulating the microbiome has now created the conditions for the gut lining to heal. But we also specifically support this with specific things. The tight junctions that have been degraded by the LPS and the dysbiosis now need the raw building materials to regenerate. So some nutrients with the most evidence that we use, L-glutamine. This is the primary fuel source for the enterocytes, which are the cells of the small intestine lining. Zinc, carnosine, has specific evidence for tight junction integrity. Collagen peptides are fantastic for structural support. Deglycerinated licorice, or DGL it's called, it provides restoration of the mucosal lining, which is this like barrier of like a mucus that lines the guts and keeps them hydrated. And then N-acetylglucosamine, which also builds that mucosal layer. The butyrate now being produced by the reinoculated bacteria is also driving barrier repair from the inside. So this is another reason why the sequence matters, because reinoculating generates the fuel that repair depends on. Systemic inflammation that has been running for months or years doesn't resolve the moment the gut lining heals. Repair also includes targeted support for reducing the broader inflammatory burden, using things like omega-3 fatty acids, anti-inflammatory botanicals, and addressing the HPA axis dysregulation or stress axis. So rebalancing, which is the 5th R, getting into phase 5, it doesn't exist in isolation. It's in constant bidirectional communication with the immune system and the nervous system, as well as the endocrine system, the metabolic system. All those systems have been operating under the influence of a chronic gut-driven inflammation, sometimes for years. So rebalancing these addresses the systemic effects that don't automatically go away when you heal the gut. And so that's where we start to focus on hormonal patterns, particularly estrogen metabolism, which depends heavily on a specific set of gut bacteria. Thyroid conversion, which has a gut-dependent component, blood sugar regulation, insulin sensitivity, which chronic inflammation impairs all of these. They're managed with dietary structure, targeted support, as well as lifestyle interventions. So this phase is heavily dependent on long-term dietary and lifestyle architecture that will determine whether the gut stays healthy long-term or not. A rebuilt microbiome requires maintenance. The organisms that were just reestablished need a dietary environment that can continue to support them. So this is where sustainable eating patterns, stress management practices, sleep hygiene become part of the clinical plan rather than just some generic advice. And so this is built directly in for you. The final phase, this is what we call R6, Reintroduce. So it's a methodical reintroduction of foods that we removed during treatment. This step is important to understand correctly. So the goal of this protocol is never permanent food restriction. You can never eat something ever again. Restriction during the remove and early repair phases is very therapeutic. It creates the conditions for healing. Once the gut barrier has been repaired and the microbiome reestablished, many foods that were previously like reactive or causing inflammation can be tolerated now because the mechanism driving the reactivity has been corrected. So we systematically reintroduce things, one food at a time, monitoring for reactivity. Most patients find their food tolerance has expanded significantly compared to their baseline when they started. Sensitivities that normally had been maybe present for years, sometimes for a decade, they often resolve entirely once that barrier is now intact and the immune system is no longer in a state of chronic activation. So when appropriate, this phase includes a follow-up gut zoomer to confirm the clinical picture, the targeted pathogens have been cleared, the beneficial populations are reestablished at adequate levels, and that permeability markers, including zonulin, have normalized. Because testing is one thing, but retesting is confirmation. So now let's take a step back and let's just look at everything. So 6 steps: remove, replace, reinoculate, repair, rebalance, and reintroduce. Each one follows the biology. Each one is sequenced to create the conditions for the next. That is what makes this a protocol rather than a collection of interventions. You're not throwing things at a problem. You're restoring a system in the order that systems need to be restored. And the reason this produces results across such a diverse range of symptoms, fatigue, cognitive function, joint pain, skin, mood, metabolic, it's precisely because those symptoms were not separate problems. They were downstream expressions of the same upstream dysfunction. Fix the root, the downstream follows. And so if what I've described today matches your experience, multi-system symptoms, expanding food sensitivities, fatigue, brain fog, normal labs that don't match how you're feeling, I want you to understand something very clearly. Normal labs in conventional medicine means we did not find a declared disease. That's it. It doesn't mean that nothing is wrong. Gut dysbiosis and intestinal hyperpermeability will not show up on standard blood panel or a colonoscopy. They are not part of the conventional diagnostic framework, which is why they're often missed consistently, and consistently in people who are genuinely unwell who then show up in our office years later with the same problem that's now worse. Because the mechanisms we discussed today are documented, the testing is precise, the treatment protocol is logical and sequenced, and this isn't some fringe alternative medicine. This is functional medicine, which is doing what it's designed to do. Look upstream, find what was missed, give the body what it needs to restore function. And so to learn more about functional medicine and any of our functional medicine programs, or to see if this is something you might be dealing with, I would encourage you, go to ascendfunctionalhealth.com, schedule a consultation with myself or one of our other providers, and let's create a personalized plan for lifelong gut restoration. If you're a listener of the show, you always get an exclusive discount and price reductions on protocols, lab tests, so be sure you tell us where you heard about us. As always, if you found value in today's show, please like the show, follow, subscribe. That way you don't miss anything. And please share this with someone who needs to hear it. That's how we grow this message and we're able to change more lives. Also, go visit ascendfunctionalhealth.com and sign up for our newsletter or in the podcast show notes. Check out our resources page. You can learn more about our cutting edge approaches to nutrition, our different therapies, and how we are helping change lives, not only in Tampa, but across the country. So I want to thank you again for tuning in to Health Decoded. I'm Dr. Alessi, and I will see you on the next one.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.